And then we move to sharing the screen and okay. So as you see, we are going to speak about psychiatry, working in psychiatry, and this is unit 9 of the book we are studying with. And so we start with the first slide, and I would like to make it full screen. So can you see the slide full screen?
Yes, ma'am.
Yes, ma'am, but it is not full screen.
It's not full screen, so we need to do it one more time, like here. So what about now?
Yes, ma'am, now it is full screen.
Well, so as we usually do, we start with the discussion, some comments on the previous task that you've done last week. So, and here are some, I would like to say some words about the video task that I watched. So I liked your stories very much. So thank you for being sincere and just speaking about your personal experiences that just made you wish to become a doctor. So the stories are very touching and very inspiring. So thank you very much. And so in your stories, you talk about, some students talk about pros and cons of the medical profession. And so they say that doctors save people's life and they are very respectful and can be compared to God. And this is the news for me. I've learned something new, that in your language there is a saying that doctors are second to God. So it seems to me very interesting. So, and you say that people trust doctors, that they have huge gratitude to doctors. And some students say that on the other hand, some doctors work illegally, which with organ transplantation, and this is the dark side of the job. Well, and I hope that this video task has helped you to reflect on why you want to become a doctor and to reflect on the mission of the profession in society. And there are some say sites from your videos. So like everything you are doing, do it with your with all your heart. This is very inspiring. And doctors are another form of God, or it's the best profession to serve people. So thank you so much for these video stories. As for the second task, which was to, the task was to use the verbs in the correct form, and you were given the conditional sentences, the first conditional and second conditional, and I was disappointed by the results of the score that you had. Some of the students didn't just take care of, didn't pay attention to these rules, and so your score is very low. And let us just look through these sentences just to focus on the main forms of the verbs that should be used in these sentences. I mean, there are two types of sentences. First conditional, which shows that the condition is real, it's possible to happen. And second conditional, the condition is hypothetical, imaginary, unreal. And it can be shown with the help of the forms of the verbs, which are used both in the if clause and in the main clause. If we have a look at the first sentence, like if it were appendicitis, Charlie's pain would be on the right side. it shows, so the form would be and the form were, they show that this is hypothetical situation, and this is the second conditional structure. And so it's imaginary, it's not appendicitis. That is why in the if clause we use were, the past simple, and in the main clause we use would plus verb, would be, like here in this sentence. As for the second sentence, if the rash will not go away, we'll send him to a specialist. Tell me please, is it a real condition or unreal condition? Or hypothetical condition?
It's a hypothetical condition.
Hypothetical.
It's not hypothetical. So the doctor says, well, if something happens, we will send him to a specialist, right? It's possible to happen.
It's possible.
It's real. That is why this is first conditional structure. You see, will send, it's not would send, it's will send, shows that this is first conditional. That is why after if clause, we should use the present simple. We speak about the future situation, but the rule says after if we never use future, we never use future simple after if. Instead of future, we need to use present simple. So what is the present simple of go in this case, in this sentence? It should be negative. If the rash. Okay, so this is yes, sorry.
Is not going away.
Look.
Does not go.
Yes. So to make a negative form in the present simple, we should use do or does. In this case, this is does not go away, because rash, this is the third person singular, it. Yes. So if the rash does not go away, we'll send him to a specialist. As for sentence 3, if it becomes something sinister, the headache would probably be constant. We have would be, would probably be. This form shows that what kind of conditional, real or hypothetical? Which condition is it? Real or unreal? It's hypothetical, imaginary situation. So because we have would, not will. That is why we need to use past simple in the if clause after if. So it shouldn't be become, it should be the past form of the verb. But there was the verb to be given in the brackets just to change its form. That is why we need to use past simple of the verb to be. What is the past simple of to be? Hello, guys. Are you here?
Yes,
Yes,
ma'am.
Okay, so the past of to be is were, right? Yes, was or were. Here in the if clauses, we normally use were. If it were something sinister, the headache would probably be constant. So then the next sentence, if your father gets any worse, he will probably admit, we will probably admit him. Is it real or hypothetical?
Ma'am, real.
Real, yes. And exactly. And the form of the verb will admit, which is future simple, shows that the
Future.
that this is the first conditional structure, which shows us that situation is real. So that is why in the if clause we can't use future. Instead of future we use gets. Yes, if your father gets, this is present simple. The next one, if I did the operation again, I would take greater care. Is it real or hypothetical?
Ma'am, real.
Might be hypothetical.
Look, can we do the operation one more time, the same operation?
No, ma'am.
No, the situation is imaginary, hypothetical. That is why And would shows that this is second conditional, which is used to show that situation is hypothetical. That is why after if we use did, the past simple, if I did, I would take. Number 6, see if it were meningitis, your child probably wouldn't be so lively. Is it real or hypothetical?
Hypothetical, ma'am.
Exactly.
Because it says it were.
Yes, you are right. And because it's not meningitis. So the doctor says if we imagine that it were meningitis, and wouldn't be shows that this is second conditional, hypothetical. And in the if clause we use were, the past simple of the verb to be. And number 7, if I set the exam again, I will prepare myself better.
Hypothetical.
Hypothetical.
Yes, that is
Imaginary.
why it's wrong. It's just this form will prepare is wrong, because in the if clause we have
I would.
that past simple. What should be the form of prepare?
I would.
I would prepare myself better. Yes, because it's impossible to take the exam in some cases one more time. Okay, and number 8. If your mother needs any medication, we would give it to her. Which, real or unreal?
Ma'am, real. Ma'am, real sentence.
Real. Would give. No.
Yes, ma'am.
Would.
Ma'am, if your
shows-
mother needs any medication.
Look, would
Yes,
shows
ma'am.
that this is unreal. I mean,
Yes, ma'am. Hypothetical.
hypothetical, yes, because your mother doesn't need any medication, but just in case. That is why instead of need, we should use past simple. What is the past simple of need? If your mother, the past tense, past simple. If your mother needed
Needed.
medication, yes, we would give it to her. Number 9, if your child will be very dehydrated, you need to bring him into ND. This is a real situation. The child can be dehydrated, but so we never use future in the if clause. That is why instead of will be, we need to use the present simple. What is the present simple of the verb to be?
Yes.
Exactly. If your child is very dehydrated. And here in the main clause, you need to bring, there is no future because this is about just present situation. Last one, if your child stays in the hospital, we will keep a close eye on him. This is the real situation. And so in the if clause, we have the present, and in the main clause, we'll keep, this is the future simple. Well, so these are the correct just versions of these sentences. Well, and you can compare with what you have, because in on the Moodle site, I just drew minuses next to the wrong sentences. You can check it. Well, and now we are just starting speaking about psychiatry, and if we speak about this sphere of medicine, so we just need to start with the founders of this part of medicine, like the people, the portraits of people, which you can see on this slide. I guess you know them, at least some of them. And let us just try to remember what we know about psychiatry and its origin and its history. And here there are some descriptions of these people, and they like in the form of the question, who introduced cognitive behavioral therapy. So what is the name of the question?
Beck, 1963.
Okay, it's Beck, you're right. What about who described his structural model of the mind? So very famous person
Freud,
Freud,
1920.
Sigmund Freud, yes, he described his structural model of the mind. And who was the first to use the term psychiatry?
Memorial
Well,
1808.
Yes, because he was the first, and this is the most ancient, just the oldest picture here. So who introduced lithium for treatment of mania?
Cade, 1949.
1949.
Yes. So these are the founders of psychiatry and the people just who have done a lot for the development of this science. And the question, is it important to be aware of the history of medicine in general and psychiatry in particular? And why? What do you think?
Yes, ma'am.
Oh, please, why?
And sometimes some medications give us we can say hallucinating effects or some kind of mental drawbacks or nervous drawbacks. So it is very important to know the history of medicine because some effects they give slightly similar effects like psychiatric disorders. So we are not sure if it is the real disorder or the side effect of the medicine.
Mhm. And studying the history, we can just understand whether it has just ever happened in the past, right?
Yeah.
Mhm. Any more ideas? Or do we just study the history only from curiosity?
Ma'am, to be honest, it depends on person to person. Like the question is asked in general, like why is it necessary that we should know about a particular person's history of medicine and psychiatry? That like in this society is very judgy. So if someone has some past with some traumas, or maybe we can say some other mental situations or any other past history of medicine, then the people judge very easily, and other issues can also occur. So it's not like necessary to be aware of, but it depends on other situations. Like for example, if I was a drug addict in the past and I was addicted to morphine, or maybe we can say some other addictive drug, and now that I'm having some accident, I have stopped taking that drug, but after a few years I'm having an accident, I've broken bones, and if someone has to give me pain relieving, then he or she needs to be aware of that thing, that medicine, I was addicted to morphine and this may lead me back to the addiction. So it depends on situations whether it is necessary to know or not.
Okay, you are speaking about taking patient's history, right? So
Yes,
yes, very good example. Yes, thank you. Yes.
Now, it's mostly said we should not hide anything from our doctors and lawyers. So the doctor must know everything about the patient, like whatever medicine he was taking, whatever treatment he was taking, or he was going through some disorders. So it helps in giving him the better treatment, concise treatment. If we know
Yes.
the history, we can proceed in that way. Like Apeksha said, if the person was a drug addict, if we know already the person was drug addict, we can go through a different way. We will not use the same medicines which would set him back in that phase again.
Okay,
So
you
it is
are.
that's the point of view for a doctor, but if we take it in a general society, for
in
example,
general.
if someone
No,
knows, the
no.
question is asked on general. So I would rather
Is
say
it
that it is not
important? It is
necessary.
important. It is
Yeah, some
important.
close ones, like maybe my best friends or my family, it's fine, but it is not
No,
generally necessary for a person to
Look,
know my
in
past.
medicine,
the
I
question.
think it's used in medicinal field. So in medicinal field, it is important.
I'm speaking about the history, knowing the history of medicine like a science, not
Yes.
just the patient's history. Of course, it's very important to know the patient's history, but
Yes, ma'am.
like the history of psychiatry, for example, who started this science, who just developed the science, and what was done in previously.
The field of psychiatry. Okay, now we get it.
Okay, yeah, we thought
Okay.
it's a different
Yeah,
question. Yeah.
ma'am, yeah. It's basic. Even if we don't know it, so I think it is not very like big question for us.
I
It is
see.
okay to know
I
even if
see.
we don't know.
Yes, I understand. Okay, just but if you are curious, you can just get some information about
Yes, ma'am.
history.
It's
Okay.
interesting.
Mhm. Okay, thank you. Now let us move on. So when we speak about psychiatry, working in psychiatry, so doctors need to be very observant of the patient's appearance, behavior, and manner. And because this can help in their diagnosis. And now we are going to just focus on some vocabulary, like the words that can describe patient's appearance, behavior, and manner. So here on this slide, you can see the column which is on the left. These are nouns that describe their related to behavior, and to the left, to the right, you can see the definitions, and the task is to match the nouns and their definitions. If, for example, we have a look at the first noun, number 1, this is aggressiveness. What is the correct definition for aggressive?
The
Will
same.
to fight, argue using
Fight,
forceful
argue, and using forceful methods.
Right. yes.
Aggressiveness.
Okay. Now, what about restlessness?
Continuous movement.
Continuous movement. Exactly. Okay. Withdrawal.
moving away, not wanting to communicate.
Exactly. So we're not wanting to communicate. This is withdrawal. Then
I'm being not accurate.
distraction.
Not
Not
caring.
Distraction. No.
Inability to concentrate.
Inability to
Yes.
Inability to concentrate.
Inability to concentrate. Right. Flamboyance. What is it?
Elaborate or
Elaborate
colorful
or colorful
behavior.
behavior.
Yes. Colorful behavior. Anxiety.
A feeling
A
of worry and
feeling of worry,
nervousness.
A feeling of
nervousness.
worry and nervousness.
And carelessness is
Being not accurate and not
Not
caring.
accurate.
caring.
Yes.
Yes.
Caring.
So carelessness. Well, now we revised the meaning of these nouns, and now if you look here at this slide, we should just think of the corresponding adjectives to each of the nouns. So if we speak about aggressiveness, what is the adjective that describes behavior? Behavior is
Anger, angry.
Ma'am, angry.
Angry, ma'am, angry is the adjective.
Aggressive.
the same
Aggressive.
for aggressive. Yes, aggressive.
Aggression.
Yes,
Aggression.
right. You're right. Now, please write these just words in pairs, like aggressive, aggressiveness, aggressive. So please, I'll give you 2 minutes just to write them down. So noun plus adjective. Write, please.
Done, ma'am.
Hmm?
Done.
Okay. Well, let us just listen to Aman. Please read all
Yes, ma'am.
the words in pairs.
Ma'am, all
Yes.
aggressiveness, aggressive, restlessness, restless, withdrawal, withdraw, distraction, distract, flamboyance, flamboyant, anxiety, anxious, carelessness, careless,
Mhm. Will you repeat, please? Withdrawal, the adjective
withdraw,
withdrawn.
withdraw,
And distraction.
Withdrawn.
Distraction.
distract,
Distracted, ma'am.
Distracted. Yes, thank you. Well, yes, here they are. And we'll need these adjectives just to, yes, yes, this is just a cartoon weapons of mass distraction, like social media. And we'll need the adjectives to complete the sentences. Here we have 7 cases of the patients with some psychiatric disorders, and we should read the description of their behavior and complete each sentence with one of the adjectives that we have written. So, for example, the first sentence, John was about his appearance. He was shabbily dressed and his hair wasn't combed. So which adjective is better here in this?
Ma'am,
Careless.
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 Careless. Yes,
Yes, ma'am.
right. So please look at the other sentences, analyze them, and just use the correct adjective in each sentence, please. 3 minutes for you to complete this task. Start, please.
Completed, ma'am.
Mhm.
Then, ma'am.
Good.
Yes, ma'am.
Okay, so let us check what the adjectives. So, Papeksha, please, the second sentence about Jane.
Yes, ma'am. Jane was Nisha, one cut out. Yeah, Jane was withdrawn. She barely said a word. When she spoke, she did not look at me.
Mhm. Does everyone agree with withdrawn here?
Yes, ma'am.
Yes,
Mhm.
ma'am.
Good. And now, Misha, please, the next sentence.
Yes, ma'am. Harry was restless. That's why he couldn't sit still and kept twitching all the time.
Twitching, yes, okay, good. Now, Nivas.
Yes, ma'am. 4 sentences. Mary was very anxious. She was focused, but you could tell she was worried about something.
Anxious, okay. Then let us listen to Vandana.
Yes, ma'am. Pat is dash. She dressed in quite extravagant and formal clothes with bright colors. Pat was flamboyant. She dressed in quite extravagant and formal clothes in very bright colors.
Exactly, okay. Well, Priyesh, please, are you here?
Susan was very aggressive. She was very argumentative. I did not feel safe and sat with seat near the door.
Yes, so the keyword, I did not feel safe. She was very aggressive.
Aggressive.
Okay, thank you. Now, Rakhav. Is Rakhav here? Hello?
Ma'am, he is not here. He messaged me. He is having some network issues.
Right.
May I?
Okay, Ujval. Is Ujval here? Minus. Sayonika, please.
Yes, ma'am.
Uh-huh.
He appeared dashed through the interview, looking out of the window as if he was hearing voices. He appeared distracted throughout the interview.
Yes. Okay, thanks. Well, so, and yes, here are the adjectives. And the question, are the descriptions related to mania, psychosis, depression, or anxiety? So these are the four main psychiatric disorders. For example, if we speak about mania, the situation with Pat is like the example of mania. Pat is flamboyant. She dresses in extravagant and formal clothes. So this is the very typical behavior of the person who has this disorder. What about if we have a look at the sentences like the first sentence about John, who is careless about his appearance, and Jane, who doesn't want to communicate, doesn't look at the doctor. So what is, which disorder is it out of these four?
It looks like depression.
Depression.
Because
Exactly,
it shows
yes, this
negativity
is
in both
depression.
situations.
So
Yes,
Yes, ma'am.
you're right. If we have a look at situation sentences 3 and 4, Harry's was restless, was kept twitching, and Mary was worried about something. So what is the diagnosis in this?
Ma'am,
Anxiety.
anxiety.
Mhm. Right. And now if we have a look at the last number 6 about Susan, was aggressive. The doctor didn't feel safe, and the last person was distracted and hearing some voices. So what kind of disorder is it?
Ma'am, psychosis.
And the last one looks like psychosis, and the
Psychosis.
6th one looks like mania.
Yes, ma'am.
Yeah. About the voices, yes. I can agree. So, well, so these are the basic, just the common disorders, and we can say that the disorders are affective. It means connected with emotions, but sometimes they can also have some organic causes. These 4 disorders, and now I would like
Unit 9.
you to have a look at this slide, and this is, we are going to listen to some to the doctors. They describe their patients, 3 patients. The patients are Mr. Jones, Miss Rigby, and Mr. Dixon. And we should just draw a similar table. Please draw the table, and just while listening, we should take notes about these patients, about their appearance, eye contact, about their manner, mode of speech, insight, and doctor's feelings, what the doctors feel after the meeting with these patients. And here in this points, we can see insight. Here in this context, insight means whether the patient understands that his behavior is abnormal, that there is something wrong with him. So please draw the table. So we'll be able to just write something in this table while listening. Now you see that we have only just 1 minute left. So we'll just, the session will finish in a minute, and so let us take 10-minute break, and then we'll continue listening after the break. Okay?
Okay, ma'am.
Okay.
So have you copied the table?
Yes, ma'am.
Okay. So see you after the break.